Last year, I met a 67-year-old man whose blood sugar levels were dangerously high despite doing everything right. He wasn't ignoring his health. He exercised regularly, followed his doctor's advice, and was careful about what he ate. Yet, he still struggled to keep his glucose under control. He was on multiple medications, but even that wasn't enough to stabilize him. This case stuck with me because it's not unusual. Many seniors face the same invisible struggle. After the age of 60, the body changes in ways that make blood sugar regulation more difficult. It's not laziness, lack of willpower, or a failure to follow instructions. The real problem lies deeper: age-related insulin resistance, chronic inflammation, and subtle imbalances that silently push glucose higher every day. Imagine your body as a finely tuned engine. When you were younger, it handled fuel perfectly. Blood sugar rose and fell smoothly after meals, and insulin did its job without extra stress. But over decades, that system can become less efficient. The signals that tell your cells to absorb sugar slow down. Your pancreas works harder, your blood vessels feel the strain, and glucose starts to spike in ways that aren't always obvious. What makes this story particularly powerful is that the solution doesn't always come from new medications or complicated treatments. In this man's case, the answer was already in his kitchen. Simple, everyday foods, if used the right way, can help stabilize blood sugar, improve insulin sensitivity, and reduce the risk of complications. These are not gimmicks. They are practical, science-backed strategies that anyone over 60 can start tonight. By the end of this video, you're going to discover 5 simple foods that quietly lower blood sugar. These strategies are safe, effective, and can work alongside any medications your doctor has prescribed. And the best part? They're easy to implement and can start making a difference within days. As we age, our bodies go through subtle but profound changes that make controlling blood sugar far more challenging than it was in our 30s or 40s. One of the biggest culprits behind rising glucose levels after 60 is insulin resistance. Simply put, insulin is the hormone responsible for helping sugar from your food enter your cells to be used for energy. When your body becomes resistant to insulin, those sugar molecules stay in your bloodstream longer, causing higher spikes after meals. Over time, these repeated spikes can strain your pancreas, damage blood vessels, and increase the risk of type 2 diabetes and cardiovascular problems. But why does this happen after 60? Several age-related factors contribute. First, as we get older, our muscle mass naturally declines, a condition known as sarcopenia. Muscle is one of the primary sites where sugar is absorbed, so less muscle means less space for glucose to be stored, and blood sugar remains elevated for longer periods. Second, aging is associated with chronic, low-grade inflammation, sometimes called inflammaging. This silent inflammation interferes with insulin signaling, making it harder for your cells to respond to the hormone efficiently. Even if you're eating carefully and exercising, this invisible process can sabotage your efforts. Another factor is changes in fat distribution. As we age, many people accumulate more fat around the abdomen and internal organs, which releases hormones and chemicals that promote insulin resistance. This is why someone can have a normal weight, yet still struggle with blood sugar regulation. And lastly, lifestyle habits that may have been manageable in younger years, like irregular sleep, stress, or minor dietary lapses, start to have a greater impact because the body's metabolic flexibility has declined. The result is a vicious cycle. Blood sugar rises, insulin surges, and over time, your body becomes less effective at managing glucose. This leads to more cravings, more fat accumulation, and further insulin resistance. It's a slow, quiet process, which is why many seniors don't realize how much damage is occurring until serious health issues arise. The good news is that insulin resistance is not permanent, and even small dietary changes can make a noticeable difference. By adjusting the types of foods you eat, the order in which you eat them, and incorporating specific natural compounds, it's possible to improve insulin sensitivity and stabilize blood sugar levels. This is exactly what the next section of this video will focus on. Practical, safe, and simple strategies that anyone over 60 can start tonight to take back control of their glucose. What many people don't realize is that every meal you eat is like a mini experiment in blood sugar control. The foods you choose, the order you eat them, and even the timing all send signals to your body that either stabilize glucose or cause it to spike dramatically. Blood sugar isn't just about how much sugar you eat. It's about how your body processes that sugar, and that processing is directly influenced by the food on your plate. When you eat a meal high in refined carbohydrates or sugars first, think bread, rice, pasta, or pastries, your body absorbs glucose rapidly. This causes a sharp spike in your blood sugar levels, which in turn triggers a surge of insulin from your pancreas. Insulin's job is to pull that sugar out of your bloodstream and store it, but when spikes are frequent and severe, your cells become less responsive to insulin over time. This is exactly what insulin resistance looks like. Your body needs more and more insulin to do the same job, and blood sugar remains elevated longer than it should. The order of your foods can make a surprisingly big difference. Starting a meal with fiber-rich vegetables, for example, slows digestion and creates a barrier that prevents sugar from hitting your bloodstream all at once. Pairing carbohydrates with protein and healthy fats further blunts the spike, giving your body a chance to handle sugar gradually instead of overwhelming your system. These aren't complicated interventions. They're simple, natural ways to give your metabolism the edge it needs. But it's not just about spikes right after a meal. Chronic exposure to elevated blood sugar, even mild elevations, contributes to long-term problems like inflammation, vascular stiffness, and organ stress. Over time, it increases the risk of diabetes, heart disease, kidney issues, and cognitive decline. Essentially, the foods you eat every day are either feeding the problem or helping solve it. And here's the key point: this is completely under your control. Unlike age or genetics, which we can't change, the foods you choose and the order you eat them in can make an immediate, measurable difference. Small, consistent adjustments, like starting every meal with vegetables, including protein and healthy fats, and reducing refined carbs, can stabilize blood sugar, improve insulin sensitivity, and reduce cravings. Over weeks and months, these adjustments compound, helping your body regain the ability to manage glucose efficiently and protect against the hidden damage that high blood sugar can cause. By understanding how food directly influences glucose, you gain a powerful tool that no medication alone can fully replicate. And that's exactly what we're going to explore in the next section. 5 simple foods that quietly lower blood sugar, specifically for seniors, that you can start incorporating tonight. The first step in controlling blood sugar is surprisingly simple. And yet, most people overlook it. Start every meal with vegetables. It sounds almost too easy to be true, but this one habit can make a dramatic difference in how your body handles glucose. Vegetables are rich in fiber, which acts like a natural sponge in your stomach. When you eat them first, they slow down the absorption of sugar from the rest of your meal, preventing those sudden spikes that force your pancreas to work overtime. Think of it as a traffic light for your digestion. Fiber tells sugar, slow down, giving your body the time it needs to process it efficiently. Here's how it works in practice. Before reaching for bread, rice, or potatoes, fill half your plate with colorful vegetables. Eat leafy greens, broccoli, peppers, cucumbers, or any vegetables you enjoy. The fiber forms a barrier in your stomach that slows carbohydrate absorption and reduces post-meal blood sugar surges. The difference is not theoretical. Patients I've worked with have seen measurable improvements in just 2 weeks, even without changing the rest of their diet. The second step is equally simple: apple cider vinegar with meals. 1 to 2 tablespoons diluted in a glass of water before or during a meal can significantly improve blood sugar control. The key ingredient is acetic acid, which helps your cells respond better to insulin, lowering the sharp spikes that occur after meals. Additionally, it slows the digestion of carbohydrates, giving your body more time to process sugar gradually instead of all at once. Some studies even show that regular use of apple cider vinegar can reduce post-meal blood sugar by 20–30% in older adults. It's important to use apple cider vinegar safely. always dilute it in at least 8 ounces of water and never drink it straight. If you have acid reflux, ulcers, or sensitive teeth, consult your doctor first. A straw can help minimize contact with your teeth, protecting enamel from acidity. Together, these 2 steps, eating vegetables first and using apple cider vinegar, create a powerful 1-2 punch for controlling blood sugar. They work naturally, without medications or expensive supplements, and can be implemented immediately. The best part is that they give your body a chance to stabilize glucose with every single meal. Over time, this simple routine improves insulin sensitivity, reduces the strain on your pancreas, and helps your blood sugar levels remain steady throughout the day. By starting tonight, you're already giving your body the tools it needs to take control. It's small, manageable, and surprisingly effective. These first 2 steps lay the foundation for the next strategies we'll discuss, which will further support healthy glucose levels and overall metabolic health. At around 10:30 p.m., most people are either relaxing, scrolling through their phones, or getting ready for bed. It seems like a calm, quiet time, but inside the body, something unexpected can be happening. Hidden spikes in blood sugar levels. These nighttime sugar fluctuations often go unnoticed, yet they can have a significant impact on overall health. One of the main reasons for these spikes is late-night eating. Consuming snacks high in sugar or refined carbohydrates, like cookies, chips, or sugary drinks, can cause blood glucose levels to rise quickly. Since the body is preparing for rest, it doesn't process sugar as efficiently as it does during the day. This can lead to elevated blood sugar levels that remain high for hours. Another factor is stress. Even at night, the body can release stress hormones such as cortisol. These hormones signal the liver to release more glucose into the bloodstream, which can cause a spike, even if no food is consumed. For people with insulin resistance or diabetes, this effect can be even more pronounced. Sleep patterns also play an important role. Poor sleep or staying up too late can disrupt the body's natural rhythm, known as the circadian cycle. This disruption affects how insulin works, making it harder for the body to control blood sugar. Over time, repeated disturbances can increase the risk of metabolic issues. Additionally, some people experience what is known as the dawn phenomenon, where blood sugar levels rise during the night or early morning due to hormonal changes. Although it typically occurs later, the process can begin earlier in the night, around 10:30 p.m., without obvious symptoms. To avoid these hidden spikes, it's important to develop healthy nighttime habits. Avoid heavy or sugary snacks before bed and opt for lighter, protein-rich options if needed. Managing stress through relaxation techniques like deep breathing or reading can also help. Most importantly, maintaining a consistent sleep schedule supports better blood sugar control. In conclusion, while 10:30 p.m. may seem like a peaceful time, the body can be experiencing unseen changes. By being aware of these hidden sugar spikes and taking simple preventive steps, individuals can improve their health and maintain better balance throughout the night. At 12:30 midnight, the body begins to transition into its deepest phase of rest and repair. What you consume just before sleep can play a powerful role in how well your body recovers overnight. 2 simple yet effective additions to your nighttime routine, walnuts and hibiscus tea, can support better sleep, balanced blood sugar, and overall health. Starting with walnuts, this small handful of nuts is packed with nutrients that make them an ideal bedtime snack. Walnuts are rich in healthy fats, particularly omega-3 fatty acids, which help reduce inflammation and support heart health. More importantly, for nighttime, they naturally contain melatonin, the hormone responsible for regulating sleep. Eating a few walnuts before bed can gently signal your body that it's time to rest, helping you fall asleep faster and improving sleep quality. In addition to promoting sleep, walnuts also help stabilize blood sugar levels. Unlike sugary snacks that cause sudden spikes and crashes, walnuts provide a slow and steady release of energy. This prevents sudden nighttime sugar fluctuations and keeps your metabolism balanced while you sleep. For people trying to manage weight or blood sugar, this is a simple and effective habit. Pairing walnuts with hibiscus tea makes this nighttime routine even more beneficial. Hibiscus tea, made from dried hibiscus flowers, is naturally caffeine-free and rich in antioxidants. It has a calming effect on the body, helping to lower stress levels and relax the mind after a long day. Drinking a warm cup of hibiscus tea before bed can create a soothing ritual that prepares your body for deep sleep. Another advantage of hibiscus tea is its ability to support heart health and regulate blood pressure. Some studies suggest that it may also help in maintaining healthy blood sugar levels, making it a great companion to walnuts in your nighttime routine. To make the most of this step, keep it simple. About 5 to 7 walnuts and 1 warm cup of hibiscus tea around midnight. Avoid adding sugar to the tea, as this can counteract the benefits. Consistency is key. Making this a daily habit can lead to noticeable improvements in sleep quality and overall well-being. In conclusion, this small combination of walnuts and hibiscus tea is more than just a snack. It's a natural, effective way to support your body's overnight healing process. At 4:40 p.m., your body is still active, but it's also beginning to prepare for the slower pace of the evening. This makes it the perfect time to focus on one of the most overlooked aspects of health, the type of oils you consume daily. Fixing your cooking oils can have a powerful impact on reducing insulin resistance and improving overall metabolic health. Many people regularly use refined vegetable oils, such as soybean, corn, or canola oil, without realizing their potential downsides. These oils are often highly processed and rich in omega-6 fatty acids. While omega-6 is essential in small amounts, excessive intake can lead to inflammation in the body. Chronic inflammation is closely linked to insulin resistance, a condition where the body's cells stop responding properly to insulin, causing blood sugar levels to rise. Switching to healthier oils is a simple but effective step. Options like olive oil, coconut oil, and avocado oil are far better choices. Extra virgin olive oil, for example, is rich in monounsaturated fats and antioxidants that support heart health and improve insulin sensitivity. Coconut oil provides medium-chain triglycerides, MCTs, which are easily used for energy and may help boost metabolism. Avocado oil is another excellent option, known for its stability at high temperatures and its beneficial fats. Timing also matters. Using these healthier oils in your late afternoon or evening meals can help maintain steady energy levels and prevent blood sugar spikes later in the night. This supports a smoother transition into the nighttime fasting period, allowing your body to rest and repair without metabolic stress. Another key point is avoiding reused or overheated oils. Cooking oils that are repeatedly heated can produce harmful compounds that increase oxidative stress and inflammation. Fresh, minimally processed oils should always be your priority. The final insight is simple. Small daily choices create long-term results. By correcting the type of fats you consume, you directly influence how your body responds to insulin. Over time, this can reduce the risk of type 2 diabetes, support weight management, and improve overall energy levels. In conclusion, fixing your oils is not a complicated step, but it is a powerful one. By making smarter choices in your kitchen, you can take control of your health and move toward a more balanced, insulin-sensitive body.